So as our presentation is going to focus on the healthcare facilities, that's why we went back to understand uh, the health services delivery we have in Rwanda based on long-term strategic plan of our country. So normally we have like different levels of healthcare system. Uh, we have the management and the oversight. We have the health services provision, and we have the supporting function. Like the Ministry of Health, RPC, FDA, RMS, those are the central level management and they do oversight. And we have a tertiary level of care where we have a teaching hospital and the specialized uh, hospitals. We have a secondary level of care, a level 2 teaching hospital and the district hospital. And we have the primary level of care where we have health centers, health post, and the community. Those are the levels. But the national laboratory, blood transfusion, and emergence, these are the supporting. So what I want you to keep in mind it is our levels, tertiary, secondary, and the primary. Because during the mapping, there will be some difference in terms of the tool that we're going to use at the tertiary level, at the secondary level, and at the primary level, according to the WHO minimum requirements. The health facilities we have at different level of our level for governance. We have them at the village, cell, sector, district, and province. So this is a structure where we have to know the teaching hospital, the number, district hospital, and the research centers. Uh, for the public hospitals, are distributed according to the provincial. And we have to know the hospital. There are hospital in Kigali City, hospital in the Eastern Province, hospital in the Northern Province, and the hospital in the Southern, and those are hospital in Western Province we have. These are hospital, you are seeing that we have different hospital are classified, some are to tertiary level, at secondary level, and at the we don't have hospital at the primary level. All the hospital we have are at the secondary level and the tertiary level. Uh, in this presentation, uh, our purpose, we will start reminding you that the WHO IPC report in 2024 say that only 39% of country had IPC program fully implemented nationwide with some monitored for effectiveness. So 39% is really a low percentage. That's why in Rwanda we want to improve the implementation and maximize the program and have the monitoring for the effectiveness of our program. Uh, this, the another, we want to present and promote the minimum requirement for IPC program at national and facility level. We want to provide minimum protection and safety to patient, healthcare workers, and visitors. As you have seen, we had a previous outbreak. We always have HR in our hospital. That's why we want to improve the safety of the patient, healthcare workers, and the visitors. So serve as a foundation for mapping in hospitals, foundation for effective IPC, starting with the minimum structure, that must be in place, identify strength and gap for targeted improvement, align with WHO minimum requirement for IPC, and support national reporting and sustainability for good practice through Rwanda IPC community of practice. Those are different purpose we want to achieve through this presentation. So IPC law will have a key role in this practice. Of course, we collaborate with other partners and the national level, of course, with you as IPC focal person. So in the past, some IPC practice were considered as difficult to be implemented. But in this session, we want to increase the confidence and in the IPC focal person by starting with the mapping the IPC structure in our hospital. So we have to understand the role of mapping the IPC structure in my hospital, because I will know what I have, what I'm missing, then I will plan where I have to achieve in the future based on what I have. So the level of the healthcare facility will be, I will know my IPC law have to remind each level of facility so that every IPC focal person know the level of IPC practice and then start mapping, then from the gap and the strength plan according to the level of the facility. Uh, this is the guideline given by WHO. So IPC law in collaboration with RBC Infection Control Africa Network will provide the certificate of achievement for those who will use the WHO tool for mapping the IPC structure in their hospital, and then they will share the presentation through this community. Those who completed those mapping will get certificate, and as we are doing the test, we will keep giving you the professional development credits, and we will also lead and coordinate those activity for mapping through this community of practice. So why mapping the IPC structure uh, in my hospital is the best starting point? Because it is a foundation for effective IPC. So WHO minimum requirements for IPC highlight that effective infection prevention relies first on having the right structure, like having a program, having a guideline, having staff, and have other resources in place. If you have all these in place, this will help you to have a strong IPC program. So that's why you have to map the structure you have and then plan accordingly. So another reason it will help in identifying strength and gap. Through structure mapping, it allows the focal person to see what exists, what is missing, and where to prioritize improvement. Another reason is it will help in planning evidence-based intervention. Uh, After mapping, you will have a clear structure map, provide the baseline needed to set the target, allocate available resources, and monitor progress under the 2024 to 2029 IPC strategic plan, as well as the health sector strategic plan 5 that our country is using in the health sector. Another reason, it will enable sustainable practice because it will ensure that improvement are built on a solid, sustainable foundation and maintaining good practice. Uh, Another reason is support national goal. This mapping, uh, hospital level it is fitting into the national reporting and strengthened Rwanda capacity to prevent HI and respond to the outbreak like uh, viral hemorrhagic fever and the uh, hospital-acquired infection. All those will be targeted after doing this mapping. The What is the WHO minimum requirements? WHO minimum requirements for IPC are defined as essential non-negotiable standards that every country and health facility must have in place to protect patients, healthcare workers, and visitors, and provide the foundation of safe and quality care. So these minimum requirements are essential and non-negotiable standard. Unfortunately, globally, only 39% countries have managed to implement this. So, IPEACE Rwanda is going to guide and lead our hospital to maximize the implementation of this essential and non-negotiable standard in our facility. The purpose uh, the, is that ensure minimum protection and safety at all levels of care, guide national and facility IPC program. So if we have successfully implemented this minimum requirement, then we are safe, our patients are safe, and the visitors, then we will have a standard and quality of care. So we want IPC and IMR to understand this. We want the policymakers and the senior manager at hospital level, at central level to understand this. And the IPC committees, IMS committee at the hospital level have to understand this. And healthcare quality, patient safety, and the WASH officer, all this team have to understand the reason of implementation of the WHO minimum requirements. So the minimum requirement is composed of 8 core components. Core component one is about the program where each hospital must have a clear objective, functional, and activity, and this have to be in all hospitals. And each hospital must have the IPC guideline that are evidence-based, and they must have also SOPs, and they have to monitor the adherence of those SOPs. That's why the percentage reduced in the hospital. Some hospitals say we have IPC program, but if you are not having documents and you are not uh, testing, monitoring, reporting what you are practicing. In that case, you don't have IPC program. The Another component is IPC education and training, where you before you start training, you must have a written curriculum and approved at the level of the hospital, and these have to be aligned with the national curriculum and the policy training material. Those have to be aligned, but at the hospital level, we adopt those documents based on the level, because in the WHO minimum requirement are aligned with the level of the facility. There is requirement at the tertiary level, requirement at the secondary level, and requirements at the primary level. Then we have another core component about the surveillance. This uh, it is the facility-based hospital-acquired infection surveillance, where each hospital have to know which HI do we have. Uh, Among the HI, it's not only the the these bacteria infection like Klebsiella and the other bacterial infection. The viral hemorrhagic fever like a Marburg, like the one happening in Rwanda in the last September, was also HI because it was an infection that happened in the healthcare settings and it was transmitted in the healthcare settings. We among the requirements, another component is multimodal strategy. We have to have a different intervention that respond to the improvement of IPC, education, monitoring, and reminder and culture change all have to be in our hospitals. And core component 6, it's about monitoring and feedback. So whatever we do, whatever we are implementing, have to be monitored, and through our monitoring, you have to give the feedback. So each hospital have to monitor and give a feedback to the staff and the hospital leadership. The seventh core component is about workload and staffing. So we have to always know the available staff and the workload, then give some comments and the guidance of complying to the IPC according to the challenge we have in the staffing and the workload. So we have also to follow up to improve IPC in our environment. This is the core component 8. So we will use a different methodology to help Rwandan hospital to successfully implement the, the core component, the minimum requirements as WHO recommend. We want our hospital to start with step 1, preparatory work. Then this methodology will be detailed in the next sessions. So we will know how we have to prepare our work of mapping our hospital, uh, select appropriate IPC mapping tool according to the guidance from WHO, level of our hospital according to the national HHCP5, and the data collection. Then step 4 will be scoring and classification, then gap analysis and strengths. Then all those findings will be validated at our hospital. Then we will do action plan to improve all those gaps at the facility level. Then we will monitor and report regularly at facility level so that we can have regularly the national uh, reporting and status of IPC in Rwanda. So what we are expecting, we are expecting to have hospital that are having a real structure map in IPC that highlighting strengths and the gap. And each hospital, we are expecting to have hospital that have a dashboard for each core component, and we will have a hospital that have a foundation for sustainable and evidence-based practice. And uh, we will have hospital that are prioritizing improvement plan linked to national IPC strategy and health sector strategic plan. Our hospital will have a short-term intervention, medium-term intervention, long-term intervention, and all those will be responsible unit and timeline for each intervention. So we are expecting to have all of these in our hospitals. As a conclusion, minimum requirements form the essential foundation for IPC. Mapping the IPC structure is the first operational step toward strengthening system. Together, this action build safer healthcare services and reduce hospital-acquired infection and antimicrobial resistance. Collaboration across all levels of the health system is critical for success. A stepwise approach ensure progressive, sustainable IPC program implementation. The Rwanda IPC community of practice is going to play a key central role in fostering learning, sharing experience, and supporting hospitals in achieving and sustaining IPC excellence. So, in our next session, we will pass through the methodology section where we will learn how in our hospital we can prepare the work of mapping the structure of our hospital and which appropriate tool we are going to use in the structure mapping of our hospital. So we will know how we can structure, we can assess the structure IPC indicators in our hospital so that we can identify gap, we identify strengths, then plan. After planning, we will monitor our practice. So this is our presentation. These are guiding documents like infection prevention and control, strategic plan, uh, the core component guideline for IPC, the global report on infection prevention and control, and the minimum requirement for infection prevention and control program, uh, the assessment tool on infection prevention and control minimum requirement for primary healthcare facility, the assessment tool for minimum requirement for secondary healthcare facilities, and the minimum requirement for tertiary healthcare facilities, and the health sector strategic plan, which is the main guiding document. So make sure your practice are aligning with the health sector strategic plan 5, which is guiding Rwanda from July 2024 to June 2029. So we want to achieve more during this period. That's why the Infection Prevention and Control Rwanda organization is working on improving the IPC in our hospital. So to encourage others to join this community of practice through the website wawaipcrwanda.org, then click on join, then you will always get the notification so that you can follow uh, those webinars that will help us to build the improved IPC in our hospital and achieve the target uh, they at the level of the country, at the level global in our country. So thank you so much for your attention. And uh, before we go to the post test, so I would like to welcome question and the comments. So over to you, moderator Aksa, to read this session about education and the comment. Thank you.
Thank you very much, Dr. Jacques, for the very well elaborated presentation on how we can just use our minimum infrastructure in building our IPC programs in our respective hospital, despite its level. I like this because now no one will be having an excuse. And I think now everyone now is enthusiastic to attend the next session on how they are going to start. I appreciate that you are giving the next session so that at least now they are going to start with you while mapping and continue until they achieve what they want. So thank you for a great presentation and thank you for the entire team of IPC in making this happen so that we can have very good IPC programs in our respective hospitals. So I think it's time for questions. I see one raised hand. Jerome, I think the floor is yours so that you ask question. Jerome
Yeah,
Sanzimana.
thank you so much for this opportunity. Thank you so much, Dr. Jacques, for kind of presentation you are giving us. I'd like to come back on these levels. You have said tertiary levels, secondary level, but you mentioned that the first levels, we don't have it in Rwanda. While we have health centers, health posts, I don't know in the classification, in the mapping, how those health facility will be mapped, how they will be mapped while they are not included in those levels you have in Rwanda. Thank you so much.
Uh, Thank you, Jerome. So maybe you didn't heard the word I said. Let me show you. We have all levels in Rwanda, as uh, I I mentioned in the presentation. You see, we have the primary level of care in the health centers. We have health center, health post, and the community uh, health services. All of those primary, and these have to comply to the IPC. But in this piloting practice we are doing now, we have started with the tertiary and the secondary levels. Then, because you have not to start everything at the same time, so we have started with those who are working at the tertiary and the secondary level, because they have the IPC focal person and they have IPC committee. This, we can start with them. As this is not happening in Rwanda, then we will move to the primary after. So I think now you understand.
Yeah, thank you so much, Doctor. I understand it very well. Thank you. Thank you.
Another question? Is there a question chat or let me check if there's something chat. Meanwhile, you can raise your hand or unmute your mic and ask question. I don't see any question chat. Does it mean that everything is well understood and we are all going to follow up on the next webinar on how we are going to establish our IPC infrastructure and settings in our hospital? I think. Dr. Jacques, do you see anyone raising hand?
No, I don't see anyone who is asking a question. Or
Yeah, there's someone in a chat. Valence. Hmm. Oh, it's about those who missed the pretest.
okay, we are going to project the post test and then you can answer. So I don't know, Dr. Marie Kereri, if he has any comment, he can.
Yeah, you can continue. I don't
Okay,
think Claire is around. You can
okay.
project the question.
So now let's
Sorry, do you
project.
have a question for me, please? Sorry.
She's there.
So I was
What?
asking for your
Mm.
comment about this initiative of IP's community of initiating the quality improvement based for improving IPC in the
Of course,
secondary.
there's a, there are two questions. Sorry, go please.
Yes, I was saying to comment about this quality improvement a program of like organizing webinars in the line of the improving quality improvement in IPC in our hospitals. It's
So
just
my comment will be the committee of practice is highly necessary because it is a platform to give a shared experience, learn from others, get updated to new guidelines and new knowledge around. So it is a good platform that anyone can enroll in terms of improving their IPC practice in their facility. But in addition, it is where we get updated to the current situation of infection in Rwanda. So it is a good platform everyone can attend so that we can learn, we share, and then we grow together. Apart from IPC sessions that we are going to be receiving, we are going also to have some session about how to do a quality improvement project in our healthcare facilities, how to do a audit, and how to use different apps that now are coming out to help us in IPC audit. And we are going also to learn about the antimicrobial resistance. You know, it is a threat worldwide. And in our setting, most of the time we don't know how big the problem is, but we are going to learn how to measure, how to monitor. So it may take time to go through all those type of sessions, but we go step by step. And a third component is share opportunity in terms of research, grant, and the other opportunity that can fit the members. For example, if you get where they need someone specialized in IPC or having knowledge in IPC to go for a broad response, that is an example. We can share the links and then people may apply. So it is a good community to join when you are not only in charge of IPC, but also when you are a healthcare professional. Because knowing IPC, it is part of your safety when you are doing your clinicals. So those are my few comments. So I'm sorry I was not paying attention. Thank you.
Thank you so much. I hope you are seeing the post-test. So even you didn't do the pre-test, so you can now perform the post-test. Thank you. So I don't know if Bruce have any comment about this.
I think this is the pretest projected, right?
Yes,
Or
everyone
they have the same title.
are
That
the
is
same
the
question.
playtest.
Yes, it's a but they are the same question. Don't worry.
Ah, okay.
Don't worry.
So those who missed the can now.
Uh, because pre-test and post-test are the same question.
Hmm.
Mm.
5 more people.
Mm-hmm. Please don't leave before I take the picture after this.
Do you think the other team, the rest 4, there were 5 now. Now there are 4, maybe because one left. Do you think they are going to respond? Because now 2 minutes passed and there are still 14 who have voted. If you are having issue, you can just write in chat while responding so that we know that we have to wait or end the poll. Dr. Jacques? Hello?
Let's end the.
Yeah, I think that's a better idea
Okay.
because 3 minutes passed and no one voted.
Okay. So let's share the results. Now you see the 82% answered the the test, and uh, why? So if we try to answer the question, why do we need an IPC community of practice in Rwanda? So many people answered the question. We want it to share, learn, and strengthen our IPC. And for the question 2, what is the first step in strengthening IPC hospital according to WHO minimum requirements? So conducting an hospital IPC structure mapping, providing PPs, writing new hospital budget. So we always, before we ask equipment, we ask budget, we have to know the gap and the strength. That's why mapping have to be the first step. The third question was, how does mapping hospital IPC structure support the Rwanda IPC strategic plan 2024 to 2029? So 92% answered the question and said the it will help us to have a baseline data. Those data will help us to plan, monitor, and allocate resources effectively. So thank you so much for answering well this question, and uh, hope we uh, have this is going to help us for the to understand the effectiveness for each webinar and the what the participants learned and what we have uh, to keep going on. So thank you so much. Uh, maybe before we close, I can or let the moderator guide us on the closing
Okay,
remarks.
thank you. Thank you, Jacques. Thank you for making this webinar a success. And thank you for presenting this useful information, which I think is needed by anyone who is involved in the IPC practice. We really appreciated your effort in assisting us. I thank everyone. You responded on questions so that we understand how or like at which level the topics is being understood. I welcome everyone to attend the next session. As Dr. Jacques promised,
So maybe X has issue.
I kindly request everyone who really needs to make change. Okay?
Can you switch on your camera and take a picture?
Oh my goodness. Okay.
Yes, please.
Okay, we can switch on the camera. And I was saying that now everyone, I hope they can now I think mine has issue. I'm afraid. But anyone who can, they can did switch on the camera for the picture. I think mine has a problem. Maybe I didn't enable it when I was entering. Okay, so now I was saying like we have to follow up on the next webinar for success to be successful in our IPC practice. So, Dr. Jacques, maybe you can take picture and thank you everyone. Maybe after picture, everyone is free to go in their respective work. Thank you very much.
You are welcome. Bye. See you.
Bye bye.
See you, Chair.
See you next time.
Bye bye. Thank you.
Bye bye. Bye bye. See you.